What's the difference between an MD and a DO? Well, first of all, DOs are amazing. But beyond that, the reason that I chose to become a DO, which stands for Doctor of Osteopathy, is because it allowed me to gain all of the same education, the basic sciences, the pharmacology, the anatomy, the physiology, all of that education, but also more hands-on techniques. So osteopathic medicine allows us to do hands-on treatments with soft tissues, bones, and muscles, and allows us to treat certain conditions like stiffness in the neck, misalignments, pain in the back, in the joints and in the tissues with hands-on techniques that is above and beyond what MDs are taught in medical school. Another thing I love about DO and being a DO was that the philosophy in osteopathic medical school was much more holistic. We were taught how to understand the individual, not just trying to look beyond the person and just look at the condition. We were looking at who was the person dealing with that condition. How do we best help them in their unique situation as they're struggling not only with the physical symptom and malady, but they're struggling maybe spiritually or emotionally and psychologically, and what effect does that have on their family and on their environment around them? And so that really shaped who I became as a doctor, and it aligned really well with who I wanted to be as a provider.